Adalimumab-Aaty 40 mg per 0.4 ml subcutaneous auto-injector kit is a medication used to reduce pain and swelling caused by certain types of arthritis, such as rheumatoid, psoriatic, juvenile idiopathic, and ankylosing spondylitis. It can also be used to treat certain skin disorders like plaque-type psoriasis and hidradenitis suppurativa. This medication works by blocking a protein called tumor necrosis factor, TNF, in the body's immune system, which is responsible for causing joint swelling and damage in arthritis, as well as red scaly patches in psoriasis. In addition to these uses, Adalimumab-Aaty is also used to treat certain bowel conditions like Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. By reducing joint swelling, this medication can help to prevent further joint damage and preserve joint function. It is important to take this medication as directed by your healthcare provider and to discuss any concerns or questions you may have about the proper dosage and timing. Before you start using adalimumab, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional and the product package. Before using the medication, check it visually for particles or discoloration. If you notice either of these, do not use the liquid. If you are taking the medication out of the refrigerator, let it sit at room temperature for 15 to 30 minutes before injecting. Do not warm up the medication in any other way, such as by heating in the microwave or placing it in hot water. Before injecting each dose, make sure to clean the injection site with rubbing alcohol. Change the injection site each time to reduce injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject it under the skin on the thigh or abdomen, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule or a higher dose at the start of your treatment. Make sure to carefully follow your doctor's directions for using this medication. It's important to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition lasts or gets worse, make sure to inform your doctor. Some common side effects at the injection site include redness, itching, pain, or swelling. If they persist or worsen, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor believes that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you develop signs of infection such as a persistent sore throat, cough, fever, chills, night sweats, or painful or frequent urination. Other serious side effects to watch for include heart-related symptoms, blood in the stools, mental or mood changes, severe headache, unusual bruising or bleeding, numbness or tingling in the extremities, vision changes, joint pain, or a rash on the nose and cheeks. In rare cases, adalimumab may cause serious liver disease, so your doctor may order blood tests and monitor for symptoms during and after treatment. Seek medical help right away if you experience symptoms of liver damage such as nausea, loss of appetite, abdominal pain, or yellowing of the eyes or skin. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice anything unusual, be sure to contact your doctor or pharmacist. When taking Adalimumab-Aaty 40 mg per 0.4 ml subcutaneous auto-injector kit, it's important to be aware that this medication can weaken your body's ability to fight infections, which could potentially lead to serious or even fatal infections such as fungal or bacterial infections, including tuberculosis. Make sure to inform your doctor of any past, recent, or current infections, as well as any history of living or traveling in areas where certain fungal infections are common. Your doctor will also test you for tuberculosis before and during treatment. Additionally, there is a small risk, especially in children, teens, and young adults, of developing cancer due to this medication or your medical condition. Be sure to discuss the risks and benefits of treatment with your doctor and notify them immediately if you experience symptoms such as persistent fever, unusual lumps or growths, swollen glands, unexplained weight loss, or night sweats. Always follow your doctor's instructions and report any signs of infection promptly. Before starting adalimumab, make sure to inform your doctor about any allergies you have, especially to adalimumab or any of its products. This medication contains inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, let your doctor know about your medical history, especially if you have had recent infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. Adalimumab can increase your risk of getting infections or worsen existing ones, so it's important to avoid contact with anyone who has a contagious illness. You should also inform your healthcare professional before getting any vaccinations and be cautious with sharp objects and activities that could cause injury. If you are an older adult, you may be at greater risk for infections and cancer while using this medication. If you are pregnant or breastfeeding, discuss the risks and benefits with your doctor before using adalimumab. It's important to be aware that Adalimumab-Aaty 40 mg per 0.4 ml subcutaneous auto-injector kit may interact with other medications, which could affect how it works or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Adalimumab-Aaty 40 mg per 0.4 ml subcutaneous auto-injector kit include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It's important not to share this medication with others. You may need to undergo lab and/or medical tests, such as a complete blood count and liver function tests, while using this medication. It's important to keep all medical and lab appointments. Be sure to consult your doctor for more details. If you forget to take a dose, it's important to consult your doctor or pharmacist to figure out when to take the next dose. It's not recommended to take a double dose to make up for the missed one. When it comes to storing your Adalimumab-Aaty 40 mg per 0.4 ml subcutaneous auto-injector kit, it's important to keep it in the refrigerator, but be sure not to freeze it. Some brands of this medication may also be stored at room temperature, so be sure to ask your pharmacist or read the product package to see if this applies to your medication and for how long. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light and be sure to discard any unused portion of the medication. It's important to keep all medications away from children and pets. When you need to dispose of this product, be sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. Be sure to consult your pharmacist or local waste disposal company for the proper way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.